Hello, my name is Bruce Linder. I'm a physical therapist in Lansing, Michigan. I have a physical therapy clinic where we created something called the Upper Body Strength Program. We initially developed the Upper Body Strength Program for shoulders. Very quickly, after we began the strength program, we realized it was helping more than just our shoulder patients. It was helping our elbow patients. It was helping our wrist patients. It was helping our neck patients. Because of the effect it had on the patient's posture, it would help our TMJ patients, the jaw patients we had. It will also help patients with pain in the middle of the back, which was an especially tough patient for us. When they had mid-back pain, we just could never resolve that. And as we developed this upper body strength program, all of a sudden our mid-back patients, their pain's resolving fairly easily. There's one more patient type I want to discuss, and that's our breathing patients, specifically patients with emphysema. We've had several patients with emphysema that have done this program. Because of the effects of emphysema, because of the difficulties breathing, it'll bring your shoulders forward, it'll bring your neck forward, it tightens up the muscles of your chest wall, making it difficult to breathe. And we've worked with these emphysema patients on the upper body strength program, and it helped open up their chest wall, and it helps open up their breathing. And I'm very surprised. I didn't create this program to help emphysema patients, and I don't know that it'll help all emphysema patients, but the very few we've had some work with, we've helped significantly. For the most part, we're looking at an upper body strength program to redevelop the strength of your shoulders, of your arms, of your trunk, so you'll hold better posture, you'll have less pain, you'll be more comfortable. A point I'd like to bring out about posture. Many people, when they think of posture, think of pulling their shoulders back to get a nice upright posture. And while that's close, it might work better if you think of posture as if you're trying to draw your chest up. And that motion comes from the middle of your back or your upper back to help pull your chest up to a better postural alignment. That's a better concept in thinking of posture, having your chest up, than just having your shoulders back. Okay. I want to add a couple caveats to this program. The first caveat is we designed this program to be done under the supervision of a physical therapist or a physician. So use your doctor, use your physical therapist in doing this program. The second caveat is this should be a comfortable program. We don't really believe in no pain, no gain. We believe in no pain, period. So as you're going through the different exercises we're about to do, they should be very smooth, very comfortable. So the next step is it's a lightweight exercise program. Lightweight means different things to different people. For us, it means roughly 0 to 5 pound weights to work out with. For our athletes, we might go as much as 8 or 10 pounds, but that's the very most we'll go for. The next is repetition. Typically, we'll ask patients to go 15 to 25 reps, 1 or 2 sets a day. And again, our athletes who want to do more, we'll have them do 3 sets a day. So ask your doctor, ask your physical therapist about this program. Make sure you're comfortable while you're doing this program. Use light weights, and if you're looking to make the program harder, increase your reps. We're about to get into the exercise program, and there's a variety of weights we're going to use. In fact, today I'm going to be using the 3-pound weight to do all 6 exercises. I could use the 5-pound weights for a couple of the exercises. I could use a 1-pound weight. These are fairly light. What's most important is that I have good technique, not that I have more or less weight. When you start the exercise program, you might only be able to use 1 pound or even 0 pounds. I kind of discourage people from buying a 1-pound weight, even if that's what they need. If you have cans of Campbell's soup at home, just use soup cans, and they're roughly a pound. And then, as you know, in a very short period of time, you can develop strength and comfort, and you can go to a 2 or 3 pound weight. And at that point, buying a weight makes sense. But if you need a 1-pound weight, don't use one. Just look in your cupboard for whatever cans of food you have, and they'll work great. With the first exercise, we're doing elbow curls. I'm starting with my hands next to my sides and then rotate my hands up just to more effectively address my biceps muscles. Also, you notice during the exercise, I'm trying to keep my eyes straight ahead or even slightly elevated to help keep my posture up. I might look down for the purpose of looking at the camera. What my goal is to look straight ahead or slightly higher to help my posture stay up. So I'm looking up, curling my hands up, arms back down. Speed of the exercise is just a nice comfortable speed. You don't have to go real fast, you don't have to go real slow. This is not a very intense exercise, so you don't have to really drag out the exercise itself, but of course you don't want to whip through it either. The next exercise, starting at chest level, is pressing your hands overhead. And again, I'm trying to look up while I'm raising my arms up over my head. Now, one of the secrets of the exercise is I don't want to lift my hands up in front of me. I try to lift my hands straight up overhead and then back down. And when you do that, when you go straight overhead, you're working your upper trap muscles a lot more effectively than when you're letting your hands come forward. So the motion is from your chest, straight up overhead, back down. Exercise number 3 is a simple jumping jack motion. If you didn't have weights in your hand, it would be just the same as a jumping jack without jumping. We call them standing jacks. Hands to your side, rotate around, clap up overhead. Like exercise number 1 where we're doing press-ups overhead, we want the jumping jack motion, the hand clap motion, to be right above your head, not somewhere in front of your head. We also want your elbows mostly straight. They don't have to be locked straight, rigid when you come up, but you're not bending your elbows and barely getting shoulder motion out of it. So your arms are mostly straight as you reach up overhead to complete the exercise. The next exercise we're doing is reverse butterflies. Positioning of this is important. What works nice, if you have a kitchen counter at home, and everybody does, go up to your kitchen counter and you're going to put your forearm on the counter. And you're going to put your forearm on the edge of the counter, you're not putting it somewhere in the middle of the counter. Take a big step back, feet are spread apart, you're nice and stable, and what we're trying to affect is that your trunk is parallel to the floor. We're not having your arms straight up because then your trunk's not parallel to the floor, so the shoulder motion comes out wrong. So you've got your forearm on the counter, your feet are back, wide apart, you're nice and stable, and then the weight's right below your eyes. The motion then is straight out sideways while you keep your eyes down. When I'm coming out sideways, I'm almost hitting the counter coming up, going straight out sideways. I'm not taking my arm behind me, twisting my shoulder wrong, I'm trying to get it straight out. The exercise as you're coming up sideways, like the jumping jack, you want your elbow mostly straight. It doesn't have to be locked rigid. That's actually fairly uncomfortable. Letting it bend some is just fine. You want to do exercise for both arms. Even if you say you're doing this for a shoulder program and it's your left shoulder that's a problem, we're still doing the right shoulder because we're addressing the whole posture. And again, for balance, you always want to work both arms to make sure that they're moving both comfortably and both strong in both directions. So you're always doing the opposite arm as well. One more point to make on this exercise. When you're leaning over in a position, nice and stable, you're taking your arm out sideways, keep your eyes looking down at the floor and you get nice shoulder motion out of it. Even if your shoulder only comes up halfway, it makes it all shoulder. If you follow the weight with your eyes, halfway up it's all shoulder, and then at the end you're starting to throw in trunk rotation more than shoulder rotation. So keep your eyes down to make sure that you're doing all shoulder. I have a mat table to do these exercises with, but most of you at home don't have a mat table. So I'm going to demonstrate these done on the floor, and it works just as well on the floor as it does lying on a mat table. The first one You're taking your arms all the way out sideways, stopping at floor level, coming back up. Your arms don't have to be locked rigid. They can bend a little bit as comfortable, but they shouldn't be bent grossly, so you're not really opening up your chest wall. Lying on the floor, taking your arms up. The next motion, taking your arms up overhead, just to the floor level, and again, elbows slightly bent, they don't have to be locked rigid. With some of our shoulder problems that have some instability issues, we always watch the patient real close with this. So certainly if you've had any type of shoulder surgery, you should be talking through these exercises with your doctor or with a physical therapist. Okay, that was our upper body strength program. Just to review, talk to your physical therapist, talk to your doctor to make sure you're on the right track. If you're having more than a little pain, you're pushing yourself too hard. Back off. I guess in closing, I hope this program helps you as much as it's helped our patients. Thank you.